right, so good morning and welcome everyone. Ted Burden has assigned me a very important piece of business before I get started. He said we ought to take a selfie. So for our first task here, let's see if I can get this done. All right, everyone, look at the camera and smile. Ready? Here we go. All right. Okay. So I hope everyone had a chance to mingle a bit, grab some delicious breakfast tacos. I tried the migas myself. Any favorites out there for tacos? Migas. All right. All right. You know, my first migas just a few weeks ago with Ted, and I'm just so grateful to be here with all of you. I think you can feel the energy in that room as we're all gathering. And I want to just start by saying a huge thank you to everyone who was involved in creating this morning's event for all of you. In particular, Jeannie Verdon and her team, Ted Burden and team. Thanks, everyone. I also want to share that this morning was designed specifically with all of you in mind. So we wanted to create an experience that you might find energizing, inspiring, help you connect with our mission, connect with each other. There's so many new people here. Hopefully you met somebody new. And then provide some information about where we're going. And so we want your feedback. So after today's event, you'll have a chance to share with us what you liked, what you want to see more or less of, and we hope to get better as we go. But we look forward to your thoughts. So the theme for today, Thriving Together, 2 decades of transformation of healthcare in Travis County. And my remarks this morning, and I think a theme that you'll hear throughout this morning, is around the roots of trust. So I want you to imagine this beautiful heritage oak, those deep roots sinking down, supporting that strong trunk of our history and where we've been, and those beautiful branches reaching up to the future and where we're going. So let's talk a bit about that. As we stand at the precipice of our 20th anniversary, I think it makes sense to look back at where we've been. 20 years ago, there were some visionary leaders who came together and imagined what this could be. Helped envision Central Health. The voters of Travis County approved that process and have stood behind us year after year for the past 20 years. I want to thank the people on whose shoulders we stand and that support that's gotten us to this point. I want to also thank the CEOs who've come before me. So Trish Brown and Mike Giesland. If you look up there on the top right, we're in the Mike Giesland Community Room at Hornsby Bend. You know, let's give it up for Mike. We wouldn't be here without Mike's vision and leadership. We're on the precipice of where we're going next because of what he saw and the way that he led the organization over the past 7 years. I'm deeply grateful for Mike's leadership. And this particular room, if you haven't seen it at Hornsby Bend, I encourage you to go check it out. This beautiful, dignified building, decorated with artwork from the community, really sort of one of the first early steps, a visible step of who we are and where we're going. This is the year where we change the narrative around Central Health. Who we are, what we do, where we're going, how our community, how our partners, how our elected officials see us. And I think we have an incredibly bright future. The fullest potential of our mission will be on display this year and the years to follow. And there are 3 reasons I'm so optimistic about our ability to accomplish that fullest potential, and I'm going to share with you today. Reason number 1 is our people, all of you, all of us. I've had the privilege of meeting about 200 of you so far in my first month on the job, and I can share with you there hasn't been a single person who has been lukewarm about working for Central Health. We are fired up to be here. People are passionate about the mission, about each other, about our teams. You go the extra mile to have each other's back, to do the best work you possibly can. You go the extra mile for your patients, for our patients. I'm so fired up. And there's nothing that we can't accomplish with the kind of team that we have today. Just look around you. I'm so grateful to be with all of you. This is the most important reason I'm optimistic. Yeah, thank you. Reason number 2 has to do with our support, the particular way that we're supported. many health organizations have to limit what they do based on what they can bill for and charge for, be paid for. And as we know, insurance companies don't necessarily pay for everything that our patients need. We know that deeply. We, on the other hand, have the freedom to look at our patients, listen to them, provide the whole person care they need and want to meet our patients where they are because of the kind of support that we receive from the people of Travis County. That is a huge freedom. It allows us to create some of the experiences I'll share with you in a moment and that you'll hear from others on the stage today. So that freedom to actually support the services our patients deeply need, that is the second reason why I'm optimistic. And the third reason has to do with our particular history. So as you may know, we are the only hospital district in Texas that has not run a hospital for the past 20 years. And why does that matter? Well, because once you run a hospital, something unexpected and sort of insidious happens. Even though it's a small portion of what you do, so much of the money and the revenue runs through the hospital that little by little, the priorities, the measurements, the accounting systems, primary care, for example, is most often seen as a loss leader, where the expenses exceed the revenue, but we know it's just the opposite, right? That's where the value is created. The leadership, the governance, all the sort of forces begin to bend toward the hospital. If you imagine gravity sort of runs down toward the hospital, and the system assumes the hospital is the center of the care. We are different. We have worked for 20 years where the community is the center of the care. We partner, we have a public health mindset, we work through agreements and relationships and trust. We're going to bring that DNA to the work of layering on increasing layers of complexity and acuity, potentially up to the hospital level, but we'll do that in a way in which we understand that gravity points back to the community. We want to get people back to their homes, back to their families, back to their context of care as soon as we can, as safely as we can. We will design for that specifically, and you'll hear some of those ideas in the way that we've begun the work in Health Equity Plan in today's program as you listen carefully. We're going to be a different kind of hospital district, one that I believe has the potential to be truly patient-centered, whole-person care-focused, high-value, and allowing that gravity to pull ourselves back to the community. That could be one of our greatest strengths as we move forward. So that's reason number 3. I'm so excited. Thank you. So in the past few weeks, I've had the great privilege of visiting with some of you, and there's hopefully a lot more to come. And I want to lift up 3 stories that I've heard about in the last few weeks. As I do this, I want to acknowledge there are hundreds of these stories, I believe, that are going on all across our system. I may not have seen them, I may not speak to them today, but please know how much I appreciate you, how much I recognize the work that we're all doing. So I lift these 3 up, not to cast any shade on others, but just as an example of the beautiful things that I've seen so far that I'm so excited about. So, story number 1. This is the Northeast Health and Resource Center. For those who've met Monica D., Monica R., seen this humble, thank you. This humble portable that sits in the parking lot of a school, the moment you walk through the door, and it's a moment like walking through the magical door at Hogwarts, all of a sudden, the space is twice as large. You've got beautiful wood-paneled rooms. It feels warm and welcoming. I don't know how that magic happens, but it does. And the Monicas and their team have recognized that some of our patients, not only low income, but they may not speak English as a first language. They may not feel comfortable navigating a computer, especially filling out complicated forms on that computer. They may not feel comfortable with all the terminology of healthcare. Navigating the online enrollment process could be quite daunting and challenging. So having recognized this, the Monicas have created this beautiful process. If I'm one of those patients, I walk in to the NERC, and just on my left is a dignified little workstation. I'm greeted in my own language. I sit down at that desk. I'm put on the phone with somebody who speaks my language from the eligibility call center. And that person walks me through the whole application, is filling it out line by line for me, and then mailing this complete application to my home address with an addressed, stamped envelope. I just have to open it up, sign it, put it back in the mail to confirm my place of address, the last piece of evidence required for that MAP eligibility. Now that is a beautiful process, a deeply patient-centered process, a process that has recognized the barriers that I might face and has designed for that to make it as easy, as friendly, as dignified as possible. And I would bet that many more of our patients who are like this successfully navigate that eligibility process because of the work that the Monicas have done at NERC. And I lift that up because in all of your areas, there are likely places where when you pause and reflect, there are barriers in the way for our patients or for our team members. And I encourage you to think creatively, to think back to the fact that we don't have to bill and collect for everything that we do. How do we remove those barriers to make it as easy as possible for people to get the care that they need, knowing that actually this is the most responsible use of taxpayer dollars, because our patients will then get the care they need. They won't end up in the hospital. That'll, in the end, be much less expensive and the right thing to do and feel good for us as well. So beautiful processes like that. I want to congratulate the team at NERC and encourage us all to be on the lookout for those. Story number 2 is from our specialty services. So the first one is from podiatry. I love the fact that we stood up podiatry very early in our journey. This is a specialty that is sometimes an afterthought and comes later, but we know that for our patients with diabetes, with vascular issues, our patients experiencing homelessness, foot care is actually critically important. And so this is a relatively new service line for us. And on top of that, we just stood up x-ray services just a couple weeks ago at Capitol Plaza. And so literally that week, maybe even that day, an 86-year-old woman came in to see Dr. Brett Vessel and the team there. She had severe foot pain. Dr. Vessel was worried about infection and took an x-ray, which had just been brought online. And in that x-ray, he saw gas bubbles in the soft tissue of the foot. Now that is a very ominous sign that reflects the potentially life-threatening infection that person had. And the team mobilized. This was late on a Friday afternoon. And so they managed to get this woman into the care that she needed right that same day. In the end, she had one toe amputated to control that infection, but just one toe. If this x-ray had been left to wait until the Monday after the weekend, she might have lost her foot or her leg or maybe her life. And so just in the moment that we stood up this service, there's at least one woman who is alive and walking on her own 2 feet, thanks to our podiatry team. So thank you for what you're doing. And the story number 3 is from palliative care. So there's a 19-year-old El Salvadorian gentleman with muscular dystrophy who unfortunately needs palliative care services, but he was reluctant to come in. Maria from our palliative care team was able to coax him to come forward and actually come in to be seen in Spanish. When he arrived, he was greeted and brought to a room that no longer looks like an exam room, but looks like a living room. It's welcoming, it's friendly, it's dignified. And as he sat there on that living room couch, Dr. Michelle Owens helped him feel comfortable and safe, allowed some of those healing silences to linger, made gentle physical contact at the appropriate times, and drew him out. And he was willing to share that actually one of his deepest wishes was to get on the internet. You know, what 19-year-old doesn't want to be on the internet? And so we made that happen. We made sure he had a phone, he got connected to the internet. We helped him get a library card so he can now begin to go and connect with his community and learn alternatives to being at home all the time. And then we heard that actually his deepest love was soccer. He was a soccer goalie, but at age 11, because of his muscular dystrophy, he could no longer play the sport that he loves. He was crying as he shared this news with our team. And so we're in the process of seeing if we can't find a way to help him go see the Austin FC as one more piece of that whole person care, meeting him where he is. As a result of that care, he agreed to be enrolled in the hospice services that he needed at the Christopher House, and he actually re-enrolled in MAP of his own accord just later that week. So how many of our patients do we know about who perhaps didn't re-enroll? And we don't know why. This is one example where somebody did, and I wanted to lift this up as an example of the kind of whole person care, things you might not normally think of as typically medical care, that really allow our patients to be seen, feel connected, feel high trust, and then choose to get the care that they really need. So a lovely example of the work that we're doing. So give it up for the palliative care team. So as we look forward, I want to paint a very broad picture of our future. So the first path of our future is really the health equity plan, which you will hear more about from my colleagues in a moment. But this plan is a direct response to a rigorous process to understand what is needed, what is missing in our community, the persistent gaps that we are stepping forward and taking full responsibility to begin to fill those gaps. So this is our North Star. It's a compass to guide our work. It is also a place where we have raised expectations. We have sort of set the bar, and we have told folks what we're going to do. So naturally, the next step is to do what we say we're going to do, to be accountable, be reliable, deliver a high quality, and one by one knock down those key dominoes, remove those gaps in care. Hornsby Bend, you saw a picture of the specialty services that I mentioned, and more to come. So that is the main road and the North Star for our work to come. I want to add to that that we have the support of big brothers and sisters, other hospital districts that have gone before us. I'm thinking about Parkland Health in Dallas, Harris Health in Houston, and others who are willing to support us and show us how we can stand up this mature hospital district that serves as an anchor, that serves as sort of an orienting force within the public sector, really creating a space for the patients that we have the privilege of serving, where we are deeply trusted and we elevate that whole area, that whole half of the sky, if you will. So that's coming. And then I mentioned our history. I think we can actually build this in some ways with an even freer hand because of who we are, because of what we know, because we're going to build up from the community. I think we will innovate when we're all said and done. I believe that we will create a model that others will look to in some ways throughout Texas and maybe around the country. I'm so excited for that future. Now, I know that's a tall order, and I want to share with you that this picture, which you'll see on the wall if you come visit me at airport, is more than just a picture. We are strongest when we are one trunk, many branches. I think this is the way we achieve that bright future, the fullest potential of our mission, the one trunk, our mission, our family, that bright future, the many branches, all of us, all of you, our teams, our partners, and the way we bring that together. The trunk must be connected to the branches through deep trust, through the sense of family, by always lifting up the mission. The through line always goes back to the mission. This is where we all connect. Early in my journey, I had the chance to hear from a mentor a piece of advice that has stuck with me, and that is that optimism is a moral choice. Optimism is not always the easiest path. In fact, in the work that we do, it often is not the easiest path. But we go that way because the alternative is morally unacceptable to us. So I'll ask you, what is the alternative to us finding that place of deep trust, working together to reach the fullest potential of our mission? You know, if we spend our energy holding each other arm's length, protecting ourselves, if you will, because we're just not sure that we're there yet, and we're waiting for the other side to go first, well, then I think the future I described might be later than it could be, or it might not happen at all, and that is not acceptable. That is not why you're here. It's not why I'm here. And so what is the alternative? I'm inviting you all to reflect on the question, what if we had deep trust? What if there was deep trust? How would we work together? Whether within your team, with your partners, with partners in our sister organizations. How would we do this if we had trust? And then go ahead and do it. Go first. We should go first because we can, because it's right, and because that is how we reach our fullest potential. This is the year where we change the narrative around who we are, what we do, and where we're going, and how everyone sees us. We do that by leaning into the great strength of our one trunk and many branches. We do that by asking, how would we work together if we had deep trust, and then doing it. We do that by always going back to the mission. The through line is to the mission. I am so honored and thrilled to be here with all of you. I will pledge to do all that I can to create the conditions for this one trunk, many branches to spread throughout our organization and our partners for us to reach that fullest potential of where we could go, what we could do. Thank you so much for your attention this morning. I want to go ahead and lift up two of our most important partners as I close here, Community Care and Sendero Health. Jason Fournier and Sharon Alvis, if you could join me on the stage, please. And Ted, do we have a mic by any chance? A second mic? Perfect. Thank you, Jason. Thanks. Sharon. So as you all know, Sendero and Community Care are two key partners as part of our Central Health family. In the last year, Sendero has had a banner year, enrolling more patients than our whole history. Sharon has hired a dynamic team, and this year we'll be leaning on them for a critical part of our infrastructure, what's called a third-party administrator, relying on them to do that work so that we can all reach further. I'm so excited by the future potential. So glad that you're here, Sharon. And then Community Care, together with Central Health, forms what's called a public health center. It's a partnership between the public agency and the Federal Qualified Health Center. Together, we are recognized as one of the strongest combinations of these two organizations in the whole country. Community Care's strength in primary care for 15 years, and especially through the pandemic, is broadly recognized and trusted. This is the backbone of our system, and we're so lucky to have you, Jason, with us, leading that work. I'd love to give you a chance to say a few words, and then Sharon after Jason. Thank you for being here, Jason.
Yeah, thanks so much, Dr. Lee. So good morning, all. My distinct privilege for being here. I've had the opportunity to work with Pat now for about 6 weeks. What a great find for Central Health, really. And amazing work that you guys do as our partners here at Central Health in conjunction with Community Care. We can't do what we do at Community Care without you guys having our backs, without working with us. So thanks to the senior leadership team over at Central Health, Dr. Lee, our peers over at Sendero. Pat's being very intentional when he talks about trust, and that's what we embrace over at Community Care. You can trust that our patients, our communities need and deserve us. Our patients need and deserve us. That means each and every day that we get up, we have to put forth our best effort in order for them to gain access to life-sustaining care. Not only they need and deserve, but they should have a human right to, right? Within Community Care, I believe within Central Health, we believe fundamentally health care and health access is a human right. Last year, in 2023, Community Care served about 134,000 individuals. 98% of those folks had incomes at or below 200% of the federal poverty level. 60.2% were best served in language other than English. 87% self-reported that they were from a community of color or minority background. And we can't do that without the partnership that we have with Central Health. And thanks to the taxpayers here in Travis County who have committed to funding and supporting a hospital district that goes ahead and buys into making sure folks can access that care. And so critically important, 84% or almost 113,000 of those 134,000 folks were from actually Travis County. The folks that are outside Travis County tend to be pediatric and prenatal patients because our outlying counties just simply don't have access to resources. I'd also be remiss not to mention that we're sitting in LBJ's library or across from it in the auditorium. Many of you guys probably don't know, but to Dr. Lee's point, we're a community health center in partnership with Central Health. The Community Health Center program was birthed in 1965 as part of the War on Poverty. If you haven't heard the War on Poverty, it was an initiative by President Johnson following the assassination of President Kennedy, wherein he looked across the country and realized that folks who were in poverty were suffering from many different things, one of them being access to care, educational opportunities, employment opportunities. So he wanted to go ahead and lift up and allow folks to do better. And so they made a tangible investment. Hundreds of programs started during that period. Fast forward to 1970, the city of Austin engages in a program out of that War on Poverty known as the Model Cities Program, gets a little bit of seed funding, opens up the first clinic in St. John's and another one in East Austin at 4th and Kamal. That's the East Austin Health Center, where our peers now have specialty care, you guys, over there, where we used to have the pediatric residency program. And all of this is possible because he was a visionary. And why was he a visionary? You may not know this about President Johnson, but he when he was in his younger years, he used to teach English to Latino and Hispanic kids in the hill country of San Marcos. And then when he came into Austin and he saw that folks were living in similar conditions, he decided to make a difference. So political stakeholders and buying into what we do each and every day is critically important to what we're doing. And so the National Health Center program and Community Health Center program as a whole, there's only 3 programs around today that were part of the war on poverty that started back in the 1960s. Community health centers, bipartisan support always, because we demonstrate good outcomes. And we are, to Dr. Lee's point, one of the largest and one of the best public centers in the country. And there's only about 60 of us that are unique like this, where there's a governmental and a private entity, nonprofit partnership. But there's 1,400 of us across the country in 15,000 communities, serving about 31.5 million individuals. And then you couple that to the fact that the other 2 programs you guys probably know, Head Start, Early Childhood Education, is still around. That started in the 60s. And then WIC, and we partner with the Women, Infant, Children's Program. So a lot of partnerships, to Dr. Lee's point. The way we do this and do well by the communities we serve is by partnering. And we have no greater partner than Central Health. We can't do what we do without you guys. We're looking forward to partnering with Sharon a little bit more and Sendero, figure out how we can do that. But we're so happy that Central Health is stepping forward to fill voids through your health equity plan, to step up and get more specialty care in there, strengthen services relative to respite and other wraparound services, palliative care, skilled nursing facilities, and then, of course, hospital care. We're fortunate. We've got good outcomes coming into the hospital, but there's always opportunities. We have opportunities at community care to do better by our patients, so does Central Health, so do we as a community. And there's no deficit of need, unfortunately. So I probably took more time than I needed to, but first and foremost, guys, we can only do what we do because you guys commit to do it. We talk about that all the time at community care. We got 1,300 strong. We have you guys here, another 300-400 people total at Central Health and growing. And so things are going to get better and are getting better right now. So thanks for all you do on behalf of the communities and patients we serve.
Over to you, Sharon.
Thank you very much. Is this on? Can you guys hear me?
Yep.
All right. Thank you so much for including Sendero in this wonderful event to introduce your role and kick off your initiative. I cannot agree with you more on how you are approaching this from a sense of trust. I'd like to introduce some of my team that's here because a lot of people don't know them. I don't know where Tiara is. I know she's here in the crowd. So Tiara Thomas is our COO. Tiara, where are you? She's standing in the back. Hi, Tiara. I also have Dr. Mary Carol Jennings. She is our Chief Medical Officer, and she is here with us. Karen Ader is here. Karen is our Chief Strategy Officer, and our Chief of Staff, Natalie Russell, is with us as well. So this is the executive team for, also Ellie Badanici is not with us. She's our CFO, but she also plays a critically important role. I'd like to go back briefly to your mention of trust, Dr. Lee. And I've worked with a lot of CEOs in my career. I've been around for a while. And they all talk about ethics and integrity and really doing a great job. And trust gets countered in there. But a lot of time it's just part of the mission vision statement that nobody pays any attention to. And this gentleman has done nothing but talk about trust. Every time I've heard him speak, he has used the word trust. And I cannot tell you how critically important it is for an organization like Central Health and the whole enterprise to trust each other. We have got to come to that. So I'm going to challenge each of you in your own work environment to trust each other. That's where it starts. So if you're at a group and you're going, well, I have an idea, and I want to speak up and say it, but I don't quite trust that everybody's going to buy off on my idea. That's the trust. That's where you create it. The three of the group, the team that you're in, you have to challenge each other and trust that it's going to be okay. Yet if you suggest something and everybody goes, that's a really dumb idea, you have to be comfortable with that. And the other team shouldn't play that role. You ought to be able to challenge each other back and forth enough to trust that if everybody's idea counts. Let me tell you, there is no business more complicated than healthcare. There is no one in this room that knows all the answers or can put all the pieces together, because it is highly, highly complex. And so it takes a team like this, with all your diverse experiences and all of the knowledge that you bring to the table, to make this work. So on behalf of Sendero, I cannot tell you how excited we are to begin working with Central Health to really build what I hope to be ultimately an integrated delivery system that fully and very functionally and very successfully serves Travis County. So thank you for including us in this. We really enjoyed being here. Thank you all.
Thank you, Sharon. Thank you, Sharon. You guys down for a selfie to close this out?
Always.
All right, can we do lights up for a moment? All right, let's come together.
Get in here, Sharon.
All right, here we go. Ready? Okay, 1, 2, 3.
Go
Thank you,
Central.
everyone. Thank you for being here. Thanks, Jason. Appreciate you.